psychosocial risks. First of all, some additional housekeeping rules. Today's webinar is scheduled to last for 1 hour and 30 minutes, including the Q&A session. This webinar will also be live streamed through our YouTube channel, so I'd like to welcome to anyone joining through this platform. Throughout the webinar, we will launch the polling feature and gather the responses from the attendees. And as a reminder, questions can be submitted via the Zoom webinar questions screen at any time. Please state to who we are addressing the questions. We will also be able to bring audience questions or comments coming from the live stream platform. This webinar comes at a time when businesses are starting to understand that demonstrating a commitment to the management of psychosocial risk is becoming central to positioning the safety and health of people at the center of the business agenda. IOSH, the chartered body for health and safety practitioners, is also an ISO Category A liaison member of the ISO Technical Committee, overseeing further development of the Occupational Health and Safety Management Standard ISO 45001 and related guidance standards. This means that we are active participants in different work groups, including those covering some of the ISO standards under the development of the ISO Technical Committee 283 work group, such as the Communication Working Group, the Performance Evaluation Working Group, and the Psychological Health and Safety in the Workplace, where I'm pleased to be the IOSH representative. And I'm really thrilled to get to chair these amazing panelists. This is a topic we are all super passionate about, and I just can't wait to hear from these excellent speakers and advocates. I hope you are also sharing this excitement with me. They have all been key contributors to the working group developing ISO 45003, a guidance and standard on psychological health and safety in the workplace. Our first speaker, Dr. Carlo Caponecchia, has a PhD in psychology and teaches safety and risk management at undergraduate and postgraduate levels. His research interests are in human factors and safety. Carlo is also a member of the Standards Australia Technical Panel, and he's a member of the International Commission on Occupational Health, the Human Factors and Economic Society of Australia, and a board member of the International Association of Workplace Bullying and Harassment, where I was really lucky to coincide with him one year ago in Bordeaux. Our second speaker is Dr. Priya Raghunath. She's a fellow of the Faculty of Occupational Medicine and Royal College of Physicians. She's a public health physician and as well as medicine under the Malaysian Medical Association. Priya is also president of the Society of Occupational Physicians and a committee member of the Industrial Standard Committee of Occupational Safety and Health Standards in Malaysia. Our first panelist, Dr. Aditya Jain, is a member of British Standards Institution and ISO Technical Committees on Occupational Health and Safety Management, Human Capital, and Governance. He's also the Executive Officer of the European Academy of Occupational Health Psychology and an Associate Editor of the journal Safety Science. Aditya has worked as an expert advisor and collaborate on important publications in the field of occupational safety and health and well-being with the World Health Organization, the International Labour Organization, the European Agency on Safety and Health, and many other related bodies. And last but not least, we're really grateful for the participation of Mrs. Sapna Mahan. Prior to joining the Mental Health Commission of Canada, Sapna worked at the Queen's Centre of Health Services and Policy Research. She has also worked with the William J. Clinton Foundation at the Center for International Health and Development. She helped lead the development of the first in the world national standard for psychological health and safety in the workplace. And since then, she has been working with organizations globally to drive widespread adoption. So before I go through this brief introduction on the subject, we'd like to launch the first find out what would you change in the management of psychosocial risk in the workplace. Dimple, are you happy to share? Thank you. We'll probably wait another 45 seconds or so in order to see the outcomes of the polling. And maybe during the Q&A session later on we can discuss the results. Just a few more seconds for the results to come. By the way, I forgot to mention, but we have initially 1,500 registrants already. Apart from those coming from the YouTube channel, we're currently having nearly 700 registrants or attendees, so we're really grateful for that. So there it goes. Looks like an increased level of awareness is probably one most voted, followed up by better training of managers and parity between mental and physical health. And especially this last one is going to be the core of one of our presentations. So thanks everyone for participating, and we'll be commenting the results later on. And we know that demonstrating a commitment to the management of psychosocial risk is becoming central to positioning the safety, health, and well-being of people at the center of the business agenda. That's exactly the reason why we are all here in this webinar. And these are some of the figures that build on this momentum. So according to the World Economic Forum, complex transformations are having a profound impact on people's life experiences, and declining psychological and emotional well-being is affecting the wider global risk landscape. WHO, the World Health Organization, estimates that poor mental health costs the global economy $1 trillion annually in lost productivity. And revised figures by the Organization for Economic Cooperation and Development indicate that stress, burnout, depression, and other psychosocial risks are costly for employers and workers and for the society in general. And also a recent European survey from EU OSHA, the third European survey of enterprises on new and emerging risk, suggests that awareness, as we could see from that poll that we did, is still not high enough when it comes to psychosocial risk. It's been recognized that prior to ISO 45000, existing international standards for OSHA, occupational safety and health, didn't put a strong focus on psychosocial risk and management. It's true that ISO 45000 requires that health hazards must be identified and controlled, including those classed as psychosocial. So therefore, an organization is responsible for promoting and protecting both the physical and also like mental health, so both safety and mental risks. The standard also recognizes that work organization and social factors such as poor leadership, working segregation, poor communication, bullying and harassment have the potential to negatively impact on workers' mental health and well-being. And it is worth stating that this future document will provide guidance on the management of psychosocial risk as part of an occupational health and safety management system. So this This upcoming psychosocial risk guidance will seek also to provide systematic guidelines for employers and employees that will enable them to promote, develop, and improve psychologically safe and healthy work environments. And I think it's worth to mention that throughout the project we've already had like 136 participants or experts involved in the working group from 41 participating countries and 6 international liaison organizations. Our meetings have had an average of like 40 to 50 participants per meeting. And in terms of the timeline of the current ISO 45003 guidelines, the standard is currently going through public consultation through the different national standards body with close of comments by the 4th of October. The final text will be registered for formal approval by Feb 2021, and the international standard is scheduled to be published in 2021. So you still have 1 month and a half to comment through your national standards body. And I think that's all from me. Please remember that at the end of the presentation, we'll be having a live Q&A session, so please stay till the end of the session. And with all the panelists, so if you would like to place any questions, please use the question button on Zoom. And if you're watching us through our YouTube channel, you can also formulate your questions through the live streaming chat function. And I'd also like to finalize this introduction with a gentle reminder of the thought leadership content that IOSH has available in our website, from novel research to sector-oriented studies to other resources such as our occupational safety, occupational health and well-being course, our psychosocial risk microsite, the occupational health toolkit. We also recently, together with Management Today, published a workplace well-being report, the role of line managers in promoting positive mental health. And by the way, IOSH tomorrow launches a new piece of research report into workers' mental health issues and has called on employers to take greater account of what individuals need when planning their return to work. The report called Return to Work After Common Mental Disorders, commissioned by IOSH, was conducted by researchers from Tilburg University in the Netherlands to gain a better understanding of individuals' vulnerability in the return to work process for employees on sick leave due to poor mental health. So definitely something of key significance in our COVID-affected world work. And it would also be great if you could point us to the IOSH resources or mental health and well-being at work that you are familiarized with. So we'll be launching another really quick poll. Thanks for your answers. In the next like 30 seconds or so, we'll be going through the results, and this will be, I can tell you, really helpful for our colleagues at IOSH. While we're waiting for the results, I would like to introduce our first speaker, Dr. Carlo Capanecchia, to the stage. So please feel free to unmute yourself and share your screen.
Thanks, Ivan. Hopefully you can all see my screen now. And thank you also to IOSH for the invitation to be part of this seminar. I think it'll be a really important session. Firstly, I wanted to just acknowledge the traditional owners of the land from which I'm dialing into this session from, the Gadigal people, and pay my respects to their elders past, present and emerging. It's really great to be with you all to talk more about 45,003 and to see so many of my TC 283 colleagues as well who are also going to be talking today. The issue that I was asked to reflect on in this presentation was, why can 45,003 be the driving force for effective management of psychological health and safety? And I thought about that for a while, and I thought about four main issues that I wanted to briefly talk about in my presentation today. And those are the alignment of psychological health and safety within health safety management systems. The fact that the guidance itself, the content, is actually very important and very useful. Thirdly, that the standard has symbolic value, and I know that can sound a little bit strange, but I'll explain what I mean by that. And lastly, readiness, that people are very ready for this. I wanted to firstly talk about a little bit of background, and I sometimes talk about this as the OHSMS standards family tree, because it's important to remember where 45,003 fits in relation to other standards. And Ivan has talked a little bit about this. Sometimes the term I use is that 45,003 is a child standard of 45,001. It exists because in section 6 of 45,001 there is information about psychosocial issues and that they need to be identified as hazards. And so 45,003 really seeks to further explain and give more guidance on those elements of 45,001 that relate to psychosocial risk. I think it's really important to remember that we've got to look at 45,001 together with 45,003. So you've got to be doing all the things in 45,001 to be able to use 45,003. That's a really important point to make. This is just very quickly, a broad overview of the structure of 45,001. And I wanted to put this here because 45,003 is in draft international standard stage at the moment. It's not necessarily widely available. I know not everyone's seen it, but you probably have seen 45,001, and you'd be familiar with the structure, the Plan, Do, Check, Act structure that 45,001 takes. And 45,003, at least in its current form, barring any major changes, follows a very similar structure to that. So I just wanted to mention that as well. And so to that first issue of one of the reasons why I think that 45,003 can really drive change in psychosocial risk management is that it places psychosocial risks very firmly within the occupational health and safety management system. What we know about occupational health and safety management systems is that they are meant to be tailored, so they've got to be specific to the workplace context. They're integrated, they're documented, they're systematic, they've got to be monitored, reviewed and improved, and all of these are great things. And 45,001 and 45,003 are both saying that we need to make sure that issues of psychological health are part of that existing system. So not an additional system, not a bolt-on system, but an integrated part of that system. 45,003 is not unique in this. There have been many other approaches that have done this, but I think that this is going to be a very important moment, if you like, in ensuring that psychological health is part of these familiar systems that are already embedded in many organisations around the world. think that's very important because organisations are already used to doing health safety management systems. Now they just have to tweak them to make sure that they encompass psychosocial risks. This has implications for the values and the assumptions and the perspectives that should apply. It says that psychosocial risk is part of safety, and there's been debates over many years about where managing psychosocial risks and psychological health should fit and whose responsibility it should be and what kind of discipline or subject matter expertise should be applied. And it tells us the core of what we really should do. And if we strip everything else away, the core of what we're supposed to be doing is preventing harm and managing risk. I think also that in that vein, 45003 can contribute to some of the challenges that we've seen in relation to psychosocial risks. And I've listed some of those challenges here, not all of them. But if we take a step back from the detail of the standard, because sometimes I think we can get lost in detail, and look for a moment at what is it telling us, what are the themes that together those clauses are building for us, I think they do really help us address some of these challenges. So 45003 is relevant to this challenge of focusing on health promotion and awareness. We do need to do health promotion and awareness, but we've got to first do prevention, and 45003 helps us to recognise that. The challenge of the perceived irrelevance of psychosocial risk to safety is addressed through the idea of this being centrally part of an health safety management system. The document talks about competency gaps, and we all know that there are competency gaps around understanding what psychosocial hazards might be and what risk controls might be appropriate. And organisations, I think, should expect that there might need to be some competency developments coming on the back of this. 45003 also helps us address the challenge of the focus on individual level controls. By that I mean focusing on controls that are really about how individuals respond to a source of harm. Instead, 45003 reminds us about acting on sources of harm rather than acting primarily on what individuals should do once they are being harmed. The metaphor I sometimes use here is that of noise. We would never say to people, you're in a noisy work environment, you should just get better at dealing with the noise. We would never say that. But we do sometimes have a tendency to give people very individual strategies for just coping better with sources of harm to their psychological health. Placing psychosocial risks and psychological health within the health safety management system framework really helps us combat that. I know you're all familiar with the challenges of jargon and multiple terms, which has really been a problem in this field, I think. It's caused a lot of people to sort of put their hands up and say, there's too many terms, nobody really knows what they mean. There's too many of them anyway, and they're too complex. Even if the terms that are used in 45003 don't necessarily work for you or aren't necessarily what you'd prefer, they do provide us with a baseline, a foundation from which we can work and then share meaning. The whole purpose of the health safety management system is that it is systemic rather than piecemeal and individualistic. And I think it really does encourage organisations to really take ownership of these issues. So rather than thinking about what belongs to an individual and what's their responsibility, the 45003 helps us to focus on how elements of work design are really critical in becoming those sources of harm. So broadly speaking, when we look across the standard and look at all of the clauses of it, I think it has a lot of potential to directly address some of the challenges that no doubt all of you have been familiar with when talking about and dealing with psychosocial risks. And so to move on to the second point I wanted to make, I'm just being conscious of time as well. I think that the guidance in the document, and I understand not everyone's seen it, the guidance in the document is actually very good, I think. It's very useful. It provides examples of the hazards and it organises those in three groups. Those related to work organisation, social factors at work, and work environment and equipment. It gives examples of controls. So rather than being too prescriptive, it really relies on organisations understanding the context in which they operate and being able to identify the hazards relevant to them and the controls that are most suitable for their operations. Importantly, I think the document gives explanation of elements of an OHSMS that bear on psychosocial risk. Sometimes we talk about context and communication and participation and competence and procurement in ways that are very abstract. And it's sometimes hard to understand. I don't think that necessarily everyone thinks about how procurement issues might have a role in potentially increasing psychosocial risk. And the document 45003 tries to explain why those parts of the wider occupational safety management system framework are relevant to psychosocial risks. And so I think that's really important. Of course, I think that context is the one that is really important. I think it's the one that's probably done least well. But if context is really understood well, the identification of the hazards flows from there and the risk controls flow from there. So I'd be happy to talk about this more, but I think if we invested a little more in understanding context, we'd do even better. And the other thing that I think is really important is that the standard talks about the interaction between different types of hazards. We can't assume that these hazards exist alone or one hazard at a time, for which there's one document for one set of hazards and another document for another set of hazards. 45003 recognises that these hazards exist in workplaces at once, they interact dynamically, and I think that's really important for us to think about when we're being more systemic about these issues. Thirdly, I think that 45003 has real value in driving change in psychosocial risk management because of its symbolic value. I think it's important to recognise that not every organisation is going to use this standard. Not every organisation is going to adhere to it. Not every organisation is going to comply with it. They don't have to. They don't have to comply with 45001. Some of them do. Most organisations are going to use it as a bit of a guide to check what they're doing. And that is still a value. It sets a bar. And for organisations, it shows here's the kinds of things that we should be doing. And importantly, for workers, it provides an indication of here's what we should expect. I think that one's a little bit underestimated and could actually be the way in which this standard has most of an impact. That, of course, relies on making the standard available, making sure that people know that it's there. And seminars like this have certainly a role in doing that. And lastly, my last point is that people are ready. This document's going to have an impact because people are ready for it and they're waiting for it. Readiness has been built over a long time by a lot of people. It's been influenced by public awareness of work and non-work issues, including some of the major social movements. And lots of pieces of work around the world done in different ways on slightly different issues with different terminology, but all adding up to a critical mass that I think makes COVID-19 has drawn even more attention to psychological health at work. We're really thinking about that. In addition to how people are working in different ways, it's drawing attention to issues of work design, as well as the psychosocial impacts of having uncertainty in people's work. So we're at a real stage of readiness for this document where it can have an effect. And I participated in a seminar just a few weeks ago about mental health awareness, which was a little controversial at times of big change in organisations, because people were concerned that so often those events focus on what individuals can do rather than what organisations should be doing to change workloads and work design. And talking about the standard gave people quite a bit of hope that there was going to be something new to help guide organisations on how to put psychological health at the centre of their safety systems. So I think we should look forward with hope to how this document can have an effect on improving psychological health at work for people all around the world. So I might stop there, Yvonne, and hand back to you.
Thanks, Carlo, for the outstanding work you've done in the working group so far, and for providing a great picture on the future benefits that can be expected from ISO 45003 moving forward. We're getting lots of questions through the Q&A option from Zoom, and I'm trying to address some of those. I also encourage our panelists, if they can, to go through some of them, and we'll definitely go through them afterwards during the Q&A session. It's now the time for Dr. Priya Raghunath to show us the perspective from Malaysia from an occupational health angle. So Priya, please go ahead and share your screen.
Thank you, Yvonne, and hi everyone, and hello to my colleagues from ISO TC283. Nice to see all of you again. So today I'm going to bring you all to the practical aspects in terms of the complexity of managing psychosocial risks in what we could say an economically emerging country, and Malaysia being one of those countries. I'd like to give you a practical perspective on managing psychosocial risks. So in order for me to give you that, I have to talk a little bit about Malaysia. So Malaysia, probably many of you know, well known for the Twin Towers, well known for its beaches, well known for its holiday sites, rural areas. Malaysia has actually, or you could say Malaysia is a country that's somewhat in between. We are not rural, so to say. We are considered developing, but in a way we are developed. So if you look at industry in Malaysia, it started off actually with rubber, tin and agriculture, rubber being our main produce. And as time went by, we have now progressed on to manufacturing, petroleum and LNG, wood and palm oil. So we are trying to step up, and with industry stepping up, one would expect that we would take occupational safety and health to a higher level. So looking at Malaysia, just the statistics in Malaysia. So basically we cover an area of 330 square kilometers, and our gross domestic product is about 1.5 billion Malaysian ringgit. We have 14 states, with East Malaysia and West Malaysia. West Malaysia being the peninsula and East Malaysia being adjoining to Borneo. We have 32.7 million population, which is divided somewhat equally. We have about 15.9 million females and 16.8 million males, and 69.7% of our population is in the age group of 15 to 64, meaning, as you can see, they are in the productive age group. And our labor force is about 15.82 million, whereby 15 million are employed, about 37% are female and 61% are male. So I would like to share with you some mental health statistics. So Ministry of Health carries out a national health and morbidity survey. One of the surveys done in the year 2015 stated that the prevalence of mental health among or mental health problems among adults 16 years and above was 29.2%. And subsequently, a survey done in 2019, which actually focused on depression, showed a prevalence of depression of 0.9% among government employees, 1.8% among private employees, 2.2% among the self-employed, and 2.7% among unpaid workers. And up to the previous years, we could say that reporting of mental health problems at the workplace was actually not very established. We do have a reporting system for occupational diseases under the Department of Occupational Safety and Health. And this year we do have some data to share, and as of the first half of the year, up to July, 11 cases of psychosocial problems at the workplace only have been reported. And we know with COVID, that's very unlikely that we're getting proper statistics. So looking back at psychosocial hazards at the workplace, and psychosocial hazards per se have already been accepted as one of the hazards in occupational safety and health in Malaysia. However, insufficient emphasis is given to it. In the industry, we note that it's always, as we always know, it's not given the priority, but even though it's not given a priority, it should not be set aside, but it seems to have been set aside till now. And it's also seen as not really a workplace problem because of the fine line between work-related stress and personal stress. Employers do not want to acknowledge occupational stress or psychosocial hazards at the workplace. And Malaysia being still a very cultural country, there's an existence of bias and a lack of acceptance as well about psychosocial hazards at the workplace. So I look back at two older studies, but two studies that we still hold on quite tightly to, which are one way back in 1998, which was the Karasik and all job strain being associated with coronary heart disease and hypertension, which of course led to the demand control model of job stress, which we still very much refer to, as well as the term karoshi in Japan, which was sudden death due to overwork. By Shimomitsu in 1999. And we take this as examples basically to try to emphasize to the industry the importance of psychosocial hazards at the workplace and managing psychosocial risk. And just to share, about 80% of the industry consists of small and medium enterprises, and therefore most of these enterprises do not wish to look into psychosocial hazards. Now, other factors influencing psychosocial health, you could say, would be religion, culture, and beliefs. Very much because Malaysia is a cosmopolitan country. We actually have a diversity of races and religions, and these are races and religions that still very much hold on to their traditional beliefs. And so something such as psychosocial problems, which requires support from the workplace and from the family, would not be there very simply because there's a lot of old beliefs on what the psychosocial problems actually are. And the values that are placed towards this is actually very, very different. There's an indifference actually towards psychosocial problems. Stigma still exists, and it's very demoralizing. And these are things that we are really trying to change in the society and community. And this, of course, the spillover effect onto the workplace is very important because people will be people. We cannot draw a line between workplace and the community, and stress cuts across their whole lives. In terms of education, I think we still need to enhance on educating people on managing psychosocial health. And that would be very important because that's when they would take measures to prevent this, okay, be it at the workplace or not. And I think a very important point that I would like to note here would be a lack of resilience in the current generation. We do find that the young younger generation seems to have somewhat a lack of resilience, as if they're not able to manage stress as I would say the previous generations or the older generations have, and they seem to give up very easily and not want to put in or not want to fight to maintain their health. Right. So perception towards mental health problems at the workplace is very much that it is an attitude problem, as opposed to it's also genetic, and it's always considered as something brought to the workplace as opposed to something caused by the workplace. And the perception towards stress at work can be very traditional, as in it's part of work, you would have to accept it. If you can't handle it, leave because you can't manage yourself. And it's not seen as an economic priority. It's always looked in terms of as cost. So what we're actually going for is the acknowledgement by employers that psychosocial hazards exist, simple workplace stress exists. It is not a problem that needs to be dealt with or put in a different platform. We can deal with it in the early stages. It exists. We need to identify causes, and it needs to be managed. And if it's managed early and well enough, then it will not be a problem. So the questions still very much being asked by employers and workplaces are, is it really effective? And they don't seem to really see the reduction in medical cost and on spending money on managing psychosocial hazards. And they're also concerned that the employees may not be committed to follow. And as well as, I think the most important thing is it is not required by the law, and therefore they do not see the need, and the push is not there for them to do it. So if you look at the current legislation in Malaysia, so we have our Occupational Safety and Health Act 1994, whereby it states in general that, of course, the employer has to ensure the safety, health and welfare at work of all employees, which encompasses all hazards inclusive of psychosocial hazards at the workplace. So yet again, because it is still a very a law that's self-regulating and a law that doesn't emphasize specifically on psychosocial hazards, that seems to have taken a backseat for now. And in terms of notification, we do have a regulation, which is what we call the NADOPOD regulation, whereby there's reporting of all occupational diseases, and the reporting of psychosocial problems at the workplace is just begun, and hopefully in time to come, we will get better reporting with better awareness and more of a push to people to run these programs. We also have a few guidelines by the Department of Occupational Safety and Health, which is under the Human Resource Ministry. And by the way, they are the enforcement body for occupational health in Malaysia. And these guidelines look at safety and health management systems, HIRAC, as well as the prevention of stress and violence at work. But again, they are just guidelines, and getting people to abide by these guidelines can actually be pretty tricky. So the key issues we actually would like to highlight would be in terms of balancing the economic versus the health needs. I think they need to look at a long-term analysis of the health needs as versus the economic needs. A lot of calculations and analysis has to be done, and we're trying to go in those lines, make the workplaces understand, the employers understand that the balance will not be seen as yet. The outcome will take many years to come. And secondly, there is no political will. In a country like Malaysia, political will plays a very, very important role in every decision made and every step of the way. If we have that political push, we can actually move things on. But there is no political will in terms of psychosocial hazards or psychosocial health. So things that we note are things such as there's no pre-employment psychological assessment being done, to note whether one is suitable for the workplace. Is always more to physical health. There's no compulsory periodic screening required. There's a lot of difficulty in managing afflicted employees, lack of resources, lack of counseling services. We do have, but it's insufficient to cover all the industries. The cost of long-term treatment as well, plus difficulty in boarding out those with such problems or replacing them in other jobs, as well as issues related to foreign labor problems. As you know, we have foreign labor, officially about 2 million foreign workers in Malaysia out of our 30 million population, and they actually carry a lot of psychosocial problems because from home, as well as social factors that actually contribute towards the problem. So the implementation of ISO standards, I hope, would be something that will assist very much. So ISO 45001 has already been implemented in Malaysia, and we've got our Malaysian standard version, which has already been translated to the local language of Bahasa Melayu, which is Sistem Pengurusan Kesihatan dan Keselamatan Pekerjaan, and that is already currently being used. So we quite look forward to implementing ISO 45003 in the hope that it will be taken on board as part of ISO 45001, and we intend to go further and we intend to improve. This would be one of the areas that we do need to improve very much in Malaysia. And the areas to be addressed using this ISO 45003 would be things such as excessive workloads, which is still very apparent, conflicting demands, a lack of role clarity, a lack of involvement in making decisions that affect the workers, a lack of influence over the way their job is done, very poorly managed organizational change, job insecurities, ineffective communication, lack of support from management, psychological and sexual harassment, as well as third-party violence. So I just would like to share with you a little bit of a learning experience that we got from COVID-19 in Malaysia, and looking back at the mental health issues for employees. So as you know, when COVID first, or when it was declared a public health emergency of international concern, we did not have that many cases, and we had 2 waves actually. In Malaysia, it's been 2 waves. If we get another one, it's the 3rd wave. And we went in for a lockdown of a prolonged period. So at that point of time, there were essential services, there were frontliners out there. And some of the factors affecting the psychosocial well-being included new ways of working. There were many SOPs to be followed, screening upon entering a workplace, using of the mask, having to work from home, things that people were not familiar with. Maybe they were not IT savvy. There was a lot of fatigue, long hours, high workload. We encountered burnout, a fear of infection, a very real fear of transmitting a disease to their families, inadequate PPE, the difficulty of having to don and doff PPE when having to manage people. And it's also not very easy. It's very, very difficult to use a full set of PPE for a good 8 hours. It's hot. They were feeling hot and bothered and very troubled. There was a lot of hostility from patients, stigma from everyone, especially for frontliners who had to face patients. There was constant scrutiny, complaints. They were not happy at being quarantined or being redeployed. And in many workplaces, unfortunately, because the economy took a dive, there was a lot of retrenchment. So these are many of the factors affecting the psychosocial well-being, which we can probably take and learn from. And the actions that actually were taken at that point of time, what I could share with was having a mental health and psychosocial support at the workplace. And there was a program going on with participation of the Ministry of Health and the non-governmental organizations. And interestingly, here we did get the buy-in from the employers, because they finally realized the importance of psychosocial problems at the workplace. It took COVID-19 for them to see it. And we also had some support online for them to call. There were numbers that they could call to get support from the workplaces. So we did identify certain problems, as in we were not very well prepared for the psychological impact, as in a novel outbreak, with insufficient risk communication, even at the workplaces, inability to provide sufficient psychosocial support to workers, insufficient counseling services, and even healthcare workers themselves were feeling very vulnerable and very unsure of themselves. So back to the workplace measures, we again advise very strong advocacy. We have a very strong advocate, a previous chairman of our Malaysian NIOSH, Tan Sri Lilam Tai. He very strongly pushes for managing psychosocial risks at the workplace, but probably now there'll be a better buy-in on that. And hopefully with the implementation of ISO 45003 when available, it will assist in this. So we would push very much subsequently for workplace risk assessment of psychosocial hazards, adjustments at the workplace, education and risk communication, looking at empowering employees, not just to follow instructions, but to manage their hazards themselves. training certain employees, selected employees, to function as counselors because we aren't able to manage them, peer counseling programs, looking back at return to work and exit policies, and of course trying to introduce these programs in SMEs as part of the corporate social responsibility of larger organizations. I just wanted to note that, or just promote that, we do have a program by the Ministry of Health to empower employers and employees in the promotion of well-being, whereby one of the scopes is mental health at the workplace. So with this, I would like to end with a saying by Hans Sale: rather than drugs or technique, it is attitude that determines whether we perceive any event as pleasant or unpleasant. He studied this very much, and it's not about facing the psychosocial hazards at the workplace. I'll talk in terms of the workplace, but it's about how we face it and what we do to manage it. So with that, thank you very much, and I would like to remind everyone to stay safe and stay healthy within the new norms. So thank you very much. Ivan, I'll pass it back to you.
Thanks, Priya, and thanks for that really good last reminder. I'm also really grateful that you have shared this national perspective. When it comes to dealing with this risk, it's important to have a good understanding of the cultural connotations and to cover the issue through a holistic approach. And we know that OH, occupational health, is increasingly becoming central in people's working lives. We're getting so many questions about the current COVID situation, so we'll try to address those later on. It is now the time for Dr. Aditya Jain to come to the floor, so please go ahead and share your screen.
Good afternoon, good evening, and good morning, everyone. Thank you for joining in. I'm going to try and build on the presentations thus far. And the question I was asked to focus on was to talk about how does ISO 45003 build on existing or previous policy developments. And I'll basically be talking about a bit of the context, because I think the context is important. There have been a number of questions already that have been asked about what is psychosocial risk, how is it defined. So I'll just go into that briefly. I'll talk about some of the interventions, some of the controls that are required, sort of that organizations can take to manage psychosocial risk, but then focus on policy. What do governments do? What do other stakeholders, social partners do? And then talk briefly about the role of standards, and end with the benefits of 45003. So why do we need 45003 and what we hope to achieve with that? It was interesting at the start of the webinar, in the quiz, when the question was asked about what are the most important issues in this area, the first thing that was raised was we need more awareness of issues around the psychosocial work environment. Then there was we need more training for managers, and we need to emphasize the role of leaders. ISO 45000 aims to try and do all of that. It tries to create more awareness by defining things, explaining what we mean by psychosocial work environment, why it's important to do it, and how to go about doing it. So I think it adds as a training resource as well. And I think it emphasizes the role of often see this as in the same way as, or they think that this is a psychosocial risk. Stress is not the risk. Stress is the outcome. Mental ill health is the outcome of poor psychosocial risk management. And that's what the standard seeks to clarify. This confusion exists across the board, all over the world. The other thing that is often overlooked is the positive side. So if you manage the psychosocial work environment well, you lead to positive outcomes such as well-being, employee engagement, better organizational productivity, and so on. So I think again, this standard tries to emphasize that slightly. So the scope of the standard is that it seeks to provide guidance. It's a guidance standard. It's not an optical standard. It adds and gives guidance to organizations how to include psychosocial risks and promotion of psychological safety and health as part of an OSH management system. So it focuses on enabling organizations to prevent work-related injury and ill health, and also promote well-being and engagement. So it's looking at mitigation of harm, but also enhancing the upside of good risk management. I put the definition of psychosocial risk in the standard here. I've also put this in an answer in the Q&A, so you can read that in more detail. This is the definition in the current standard as of now. But basically, it covers and captures what is set in terms of what it relates to. Now, briefly, as I said, the scope of the standard includes well-being at work, and I think well-being at work is misunderstood and is used differently by different stakeholders for varying purposes. I think what's important to recognize here that well-being is an integrated concept, and it relates to the individual's health and work-related environmental, organizational, and psychosocial factors. So I think what leads to the standard focuses on what leads or contributes to fostering an environment which promotes well-being. So it's important to keep that in mind. Now, how do we address or deal with psychosocial risks in the workplace? So there are different control measures that are used. So in health and safety management systems, you typically have a hierarchy of controls. In the area of psychosocial risk management, this has typically been seen as primary, secondary, and tertiary. So primary being preventative, secondary being trying to improve the capabilities of the organization, and tertiary being rehabilitative. I'm going to focus on the legislative policy, which is basically beyond the organization in terms of what can governments, stakeholders, regional actors do to improve and promote help organizations foster a good psychosocial work environment. At the organizational level, however, companies can also implement policies, things like anti-bullying policies, codes of conducts, policies which are aimed at promoting a positive organizational culture, are all examples of primary interventions. However, what we are more familiar with are things which focus at the individual, so things like stress management training or health promotional programs or staff counseling. The standard talks about all of these different levels of control, but I think it is important to keep in mind that a holistic approach is what works, and that's what the standards tries to emphasize. But coming back to the legislative interventions, those of you who are based in Europe will be familiar with the European Framework Directive for Health and Safety at Work. Now, the Framework Directive specifies very clearly that it's the responsibility of all organizations to assess all types of risks to health and safety. Now, that includes psychosocial risks. The directive does not explicitly state it. However, because it says all types of health and safety risks, it includes psychosocial risks are included as part of the legal framework. In 2014, a document was published by the European Commission called the Interpretive Document on the Implementation of the Council Directive in relation to mental health in the workplace. I put the link on this slide. Please have a look at it. It explains in detail. So it interprets the directive in terms of how it's part of an organization's legal responsibility to actually look into aspects which affect psychological health and safety in organizations. There are also a number of ILO conventions which are relevant, and of course there are loads of national laws, not just in Europe, but also in Latin America, in Asia, in North America, and other parts of the world, which look at this issue in various ways. So a lot has been done. social partner agreements, which are agreements between employers and trade unions. There are sustainability initiatives which talk about the issues and the importance of promoting a good work environment. And also at the national level, there have been a number of initiatives. Those of you who in the UK might be aware of the HSE's management standards for work-related stress. That's a very widely used initiative and has been translated into and adopted by a number of other countries like Italy, and again takes a risk management approach towards managing psychosocial risk. So please have a look into that if you are not aware of it. And this slide basically gives you a list of a number of instruments. I mean, there's not enough time to go through the whole range of documents or policies which are relevant, but this just gives you an idea about how different, what kind of laws exist and how much do they cover these issues. As you can see, in terms of hard laws, we did a study where we identified 34 hard law instruments focusing on Europe and also those applicable globally. And we found that most of them, even though they're relevant and related to this issue, don't explicitly mention it. Most recently, last year, the ILO introduced a new convention on violence and harassment at work. That is also directly relevant to this issue because violence and harassment and workplace bullying are psychosocial risks. Again, the standard explains that in more detail. But what we see is there are a number of soft law initiatives, a lot of guidance that's been published by various stakeholders, which basically show that there has been a lot that's been done, and there is a lot of information out there which helps organizations deal with these issues. And the standard adds to that. Put a link to this report and study, which you can sort of read more, get more information on. To summarize this, what we find though is that even though there is a legislative basis, at least in Europe and some countries around the world, we don't, there are issues with enforcement of legislation. There are issues around compliance. There are obviously always lobbies for changes. There's also disregard of legislation. We know that even with standard health and safety law. And of course, in many countries, laws don't exist. However, the importance of business responsibility, the responsibility of the organization to make sure that they provide a safe and healthy work environment is becoming increasingly important. And the use of voluntary standards, therefore, plays a critical role. ISO 45001 is used on the same basis. It's a voluntary standard. And 45003 adds to that because it helps organizations address this specific issue in more detail. The way the work started in this area was with the development of two national standards. As Ivan already mentioned in the beginning, PAS 1010 was published by the British Standards Institution in 2011, which was the first national guidance standard in this area, followed by the Canadian standard on psychological safety and health. And both of these documents were input documents to ISO 45003 that is currently being developed. And Sapna will, of course, talk more about the Canadian standard in the next presentation. So, what are the benefits of 45003 to users? There have been a number of questions in the chat about why do we need a full standard for one hazard? Psychosocial hazards are not one hazard, they are multiple and cover a range of different issues. Why do we need a standard? Because there is not enough awareness of these issues. I think there is, it's hard for organizations to really understand the issue fully because it has been talked about differently. So having an international standard which builds on these national standards will hopefully provide more guidance to organizations. And of course, having the credibility of a global standard will hopefully encourage organizations to address this issue, to enable them to meet legal obligations where they exist, but also, more importantly, promote organizational sustainability because managing this issue well helps organizations be more productive, be more profitable. ISO 45003 provides guidance on how to identify conditions, circumstances, and workplace demands that have the potential to impair psychological health and well-being of employees. It helps So that's an overview of the presentation and sort of the issue. So how does 45003 work in the policy context? I think it plays a key role, hopefully will play a key role in enabling organizations to do more, because in the last 20 years, a lot has been done, but we need to do a lot more. Thank you very much for your attention. I'll hand back over to Ivan now.
Thanks, Aditya, for this excellent and informative presentation on the available policy interventions for psychosocial risk management, and also for showing us what ISO 45003 can definitely bring to the business table. It is now my pleasure to welcome our last speaker, so Sapna. The floor is yours. Please share your screen.
Thank you. It's lovely to be here with my fellow SMTC members and also many in the chat that I'm recognizing. I'll try to go a little fast here so we can leave some time for Q&A. But I'm talking a little bit about the Canadian experience around expanding our notion of health and safety to include psychological health and safety. So Canada, many of you probably know, about 40 million people, largely publicly funded our health system, and about 70% of people have private insurance to top up. I won't go through all these slides because I think everyone who's probably here today understands the business case on why. The main message here was that Canada, like many of your countries, are also struggling with this, and our workplaces have realized that about 30% of disability claims and 70% of the disability costs in workplaces are attributed to mental health issues. So whereas 10 years ago, we were knocking on the doors to convince businesses that they had a duty and a responsibility to do something, they're realizing that the cost is astronomical and there's a lot they can do to actually see a positive impact and prevent. And just on the right here, the numbers I wanted to show is that even though 1 in 5 Canadians have a mental health issue, which is much higher than other chronic issues in Canada, but it doesn't get the funding and the attention, which I think all of us have probably seen. And that's largely due to stigma. And so a lot of the work we've done in Canada has really focused on breaking down the stigma and focusing around the discrimination and changing the attitudes and behaviors. And as I said, the cost of doing nothing is huge. And I just like to highlight here one of the costs that isn't always, I would say, measured, which is around presentism. And that's really people in the workplace who are not well coming in and having an impact on others. I did want to touch on the global impact of COVID, and that, mental health and mental illness is a bit of a silent echo pandemic that's happening. In Canada, at least 50% of people have said that their mental health is worsening. And though COVID may have started with a focus on, physical issues, we're seeing the huge impact on mental health and wellness, especially as we extend this pandemic. And so what we've seen in Canada is that as workplaces have put a lot of processes and policies in place to protect the physical health and wellness of people, they're starting to shift as we reopen the economy and thinking about the psychological health and wellness. They realize they have to. As we look at reopening and potentially reclosing places in Canada, which we've just gone through in one of our areas, we're really looking equally at the physical and psychological responsibilities that a workplace has. They know that in order to keep their employees engaged and at work, we're going to have to look at the mental health impacts. So Canada has seen a bit of a unique accelerated approach in this area. Two things I just wanted to highlight at the beginning was two kind of frames in the way we think. One is it's not just about people who are suffering or not at work or ill, but it's about the one-in-one, every single person in the workplace. And those green arrows show that people are constantly moving and changing. They're healthy, they're well, they could be struggling, they can move back and forth. So it's very important that workplaces not only have programs for those who, return to work and inclusive hiring, but also those who are well. What are we doing around the prevention and promotion piece? And we've seen in Canada that workplaces where they're at, and how do we get people to recover. Recovery is possible, and that's a shift for workplaces. There's a lot of stigma that once someone's sick, they're not able to do anything and they're never going to be of use. It's about getting the help and support that you need early intervention. Get the help that you need, and people will get well and people can work. And that's two frames that have really helped accelerate it. A few other things that I won't go into, but we obviously saw quite a change in laws in the early 2000s. Discussion started in 1998. And in about mid-2000s, we hosted a roundtable that included human resource leaders, CEOs, labor, employees, and there was a consensus that Canada should have a national standard on psychological health and safety, just like we do for physical health and safety. That it would really accelerate and drive change in workplaces if there was a standard. So in 2013, the first in the world standard was released. Thank you, Aditya, for mentioning it. It's free and it's voluntary, and it's really a set of tools, not rules, that provides any workplace, small, medium, large, private, public, on how do you put policies and processes in place to prevent foreseeable psychological injury and promote well-being. I encourage all of you to visit the website below to download a free copy. It's in French and English. And it's really around continuous improvement. And a lot of what Carlos said at the beginning around the planning, the do, the act, and check, it's really aligned with traditional health and safety standards, but with a focus on psychological safety. And someone asked, why do you need a separate one? Because workplaces needed clear guidance on how to look at this, integrating it with health and safety, but really needed the skills, the direction, as well as the tools. There's an amazing annex in this standard that includes an audit tool, which I believe Ian Arnold's on today, and he was a leader in developing it. It's a wonderful tool and something that I encourage everyone to take a look at. I did want to highlight that in the Canadian standard, there's actually specific clauses around critical event preparedness. And workplaces in Canada have actually have benefited from this and used it when we've been going through COVID. And it specifically outlines some of the key things that organizations should be doing, have in place, and sustain while critical events are happening. And that's not just short-term critical events. It can be something like this pandemic that's lasting for a long time. The Canadian standard is based on 13 psychosocial factors. I think a lot of the chat, I saw some of the questions around what is the factors. These are factors that the workplace can control, that have a responsibility and accountability on. And the standard outlines, how do you assess this? How do you see where in your workplace some are strong and weak? And how do you focus on them? What do you do to improve them? And we've seen in Canada that this has worked around the workplace factors that impact employees. And certain sectors like education, paramedics, have actually added factors or tailored them, even students and students who are coming into the workplace. But these are largely the 13 kind of main factors that we look at in Canada. When the standard came out, we actually followed 40 organizations for 30 years as they used the standard to see, does it actually work? Does it have an impact? We did small, medium, large, all over the country, and it works in every organization. And since then, hundreds have been using it. Just a few small, quick examples. A hospital in one of our largest cities used it to try to reduce sick leave and absenteeism, which we know in nurses and healthcare workers, there's high rates. Well, of course, they reduced their sick leave and their absenteeism, but patient safety increased. Medical errors decreased, which seems like common sense. If your healthcare workers and those working in a hospital are more psychologically healthy and safe and well, the chances of having medical errors reduces, but we actually saw that. The biggest, largest private company in Canada saw a huge increase in their employee assistance program usage. They saw a double-digit % decrease in short-term disability. A huge public organization saw 100% return to work, which they've never seen before. And they actually documented suicides that were prevented due to what they put into place. So it has worked across the country. We've seen implementation. We've seen that if you provide a clear standard that is linked and integrated with health and safety, it can be implemented. Some of the organizations here had 4 people. It can preparation and thought going through what is in it. But some of the key things that the Canadian delegation has really felt is important is the integration with 45,001 in the health and safety management systems. We believe that worker consultation and union engagement is key. As much as leadership is important and that sustained leadership commitment, every single worker needs to believe in it, have buy-in, and be engaged. We also believe that external factors are important to consider. The key part, which I've seen a lot on the chat about, is the training and competency building. You can't just say you want to do this and tell somebody on the side of their desk to do it. You need to build competencies, not only those who are leading the standard implementation, but every worker. So whether it's mental health first aid or the working mind or other competency building programs and education, it's really important. As well as prevention and promotion. Again, it's the one-on-one, it's every worker in the workplace, and that has created a culture. You know, we always say culture eats strategy. In order to really change the culture, you need to focus on everybody. And it's not just for those who are suffering. We've put a lot of attention in stigma and discrimination and awareness, and that has been key. Data. You can't integrate or do anything in a workplace without actually measuring what the issue is. So even around the 13 psychosocial factors, it's been really important to assess what factor is the issue in your workplace. Don't just put a training program in or do a webinar or put some posters up. You have to really understand what your issues are. Look at your data. Look at what the issues are and then implement. And then make sure you measure the training program. Is it actually having an impact? And I do think it's really important when you put out any kind of guidance is to actually provide policies and tools to help with implementation. This is a newer area. Physical health and safety took years to really build up the competencies and have it widespread. And so I think it's really important to equip organizations and those who are responsible. We have to equip them with the tools to really support implementation. So I'll stop there and just say thank you very much for having me today and look forward to the Q&A. Thank you.
Thanks, Sapna, for this great presentation and for providing an accurate picture of the important work that you do at the Mental Health Commission in Canada, leading on the development and dissemination of innovative programs and tools to support the mental health and wellness of Canadians. I really love the work that you guys do in terms of advocacy. It is now the time for panelists to get together to go through some of the questions that we've been receiving from the audience. More than 100 questions already, and we've tried to solve some of those. 40 have already been answered. There's still like 50 questions open. So I'm pretty sure there's going to be like a really interesting debates going on. So if I can please ask you to share your video again. I've tried to group some of those questions, and we basically have questions in relation to measuring data, KPIs. We also have lots of questions coming from the risk management perspective, and what will ISO 45000 will include in terms of risk assessments, policies, etc. And I think then we also have the multicultural approach. So if the standard will be applicable to other countries. So let me go first with this one, the one about like leadership and engagement and management, sorry. And Anna is asking how can we ensure that those who have responsibility around this issue are able to enact and undertake the work based upon and expected of them, in comparison to traditional safety risks, I guess. So anyone would like to say how important will be like leadership and in the future standard?
I can probably start with that. I think this is an issue that is sort of talked about all the time. I think we need more leadership commitment, and I think in this area it's even more so. How can we go about enabling that? I think by see parts of the picture. And I think that's the main issue. Leaders don't understand that this is an issue which is linked to the sustainability and strategy of an organization. And I think once we can make them see that more clearly, I would think automatically you'll have leaders being committed to this issue. And again, I think the standards, both 45,001 and 45,003, talk about the importance of leadership commitment and how leaders can be engaged more in this issue clearly. So hopefully the standard will help improve this issue and address this issue.
Thanks, Aditya. That was really helpful. We've got two few questions in relation to indicators. So there's one from Sharon Robertson saying, does the 45,003 include any leading indicators to measure psychosocial risk prior to an event prevention measures? If so, what are they? And then a similar question from Marie Roberts Watkins saying that how will companies be measured against the compliance to ISO 45001 in relation to psychosocial issues and their management?
I can start with that one if you like, Yvonne. Perhaps the other, my colleagues can correct me if I'm wrong, but I can't recall that the draft standard actually specifies measures at the moment. And similar to 45,001, it says that you need to evaluate performance, but it doesn't specify the measures by which you might do that. Perhaps it's useful to note that there is a new project that is being developed around OHS metrics, and that's very much in its infancy, but I imagine that project will be able to answer some of those issues. And I think that's important because it'll go across a whole range of hazards, not just one set of hazards, but it'll continue that sense of integration that the hazards that we're talking about and all other hazards will then have some guidance around metrics that will be consistent with the broad OHSMS framework.
Anyone else would like to add anything in relation to indicators?
Yeah, I think I can sort of again just build on what Carlos said. So we don't have a tool which enables organizations to do a risk assessment. So what the standard does give you is to enable organizations to design their own tools. It tells them which areas are important, and based on that, you can create and identify leading indicators which work for you, because not all leading indicators in this area will be relevant to all organizations. And that's one of the reasons why we had a whole debate about should we put in an annex a draft or a sample of a risk assessment tool. We don't need to, there's lots out there already. We're giving information on that. So I think it's for organizations to understand the standard and then try and work in this area around developing the KPIs around this issue. Yeah.
Thanks, Aditya. We do have like a tricky question. I think it's been mentioned several times. With ISO 45003 being an international standard guidelines, how will some of the guidance and recommendations make their way down into SMEs? And I know that apart from SMEs, other challenging environments have been mentioned, like applying the standard to non-industrialized countries or emerging economies.
I can just speak on the Canadian experience, which we struggled the same thing. It was the first question. We actually got a lot of pushback from our small, medium organizations and some of the, what I'd say, non-traditional workforce. The important thing, and I think this standard will have the same piece, is it's around process and continual improvement. And it's around even small organizations of 3, 4, 10, 20, we're able to take the key pieces and start raising awareness about it, showing leadership, and starting to really integrate this into their physical health and safety processes. It'll be different how it looks in every organization, but I think this standard will be something that will be high level enough, providing guidance, but can be used in any kind of organization, whether it's small, medium, or large. And we've seen in Canada it is working. However, they do need specific maybe tools. And as Carlo and Aditya, and I think all of us know, there are so many tools out there. And what I find is the hardest challenge for people is curating through it. It feels like a buffet and you don't know where to start. And I think that will be to our countries and maybe some of our expertise and work down the road to try to help curate. If you're trying to do this or small, here's some great free or tools to use that will help you. And so I think that will be the largest piece. Less about the standard. I think the standard actually provides everything that's needed at the high level. And then it's about tailoring it to different industries, sectors, sizes. But I think most of those tools do exist.
Thanks, Sapna. Priya, would you like to add any remarks to that question as well?
I actually concur with what's being said. The standard actually acts to provide a sort of a guidance, and I think in our context it will very much be a very big basic guidance that they can draw from. But given the fact that they are not ready to progress on this, I think at least it should be something that they can draw upon and start doing things. And on a bigger level, the guidance is extremely good because it actually puts you into perspective as to what to do. However, the other part of it that we can't forget is what happens next. So it's the what next that also needs to be taken into consideration, and that is how you can use this to actually plan accordingly.
Thanks, Priya. One other question. Does the panel think that there will be an increase? Well, they mentioned like PTSD, but I could extend that one to psychosocial risk. There will be an increase in psychosocial risks among workers in the workplace, especially due to the COVID-19 situation.
Maybe yes, I can add to that. Definitely, because it's taken its toll on workers all around the world in different ways. It's affected families. It's affected the whole social context of the workers. So it's not about just looking at the workplace, and therefore I would think that definitely it would increase. Maybe not PTSD per se, but as you said, psychosocial risks. So this actually is a very good platform, and this actually has been very timely for us to bring up this standard, and it's been very useful, I would think so.
And I think one of the last questions that I'll be able to highlight, without a legal obligation, how can we convince businesses to adopt a program that might not show tangible returns in the short term?
I think there is a very strong business case. We know organizations which deal with these issues, and generally health and safety issues, which this is part of, show returns. Sometimes it might not be in the short term, but I think what we know, and this is why sustainability is important, is because it's increasingly important for businesses to recognize that you cannot just focus on the short term. So I think the business case is there, and I think also the value case, which we often miss. It is part of a responsibility of an organization. An employer cannot claim to be a responsible employer if they don't deal with these issues. And these are not hard issues to deal with. We are not talking about mental ill health. We are talking about factors that create a good work environment. So I think this can be done. It is not that hard, really, if organizations really want to do it. Whether whether they have loads of resources or less resources, of course, it's about prioritization at the end of the day. So these things matter. I think commitment is key here, and it's doable. A lot of things are doable without much cost or resource or even expertise. You don't need to be a psychologist or a mental health professional or a doctor to deal with these issues. These are all misconceptions, and hopefully the standard will help clarify all of this.
I think I'd just add a quick thing that we've seen in Canada that organizations who had integrated psychological health and safety, it was just part from recruitment to retirement, it was just embedded in how their workplace goes about business, have been more resilient and at the front end during this pandemic. They already had a actually has put them ahead on the economic side, on the competitive side. They've been able to keep their employees engaged, provide the flexibility. So I actually think this is a competitive advantage and good for business. And we're seeing that in Canada. So that's another way I think to look at it through the pandemic.
Thanks, Hafna, for that really good final messaging. I'm really sorry, but this has been a fantastic panel. Unfortunately, it's time to draw to a close now. So let me thank all the attendees from Zoom and YouTube. I think we've had an average of 700 attendees, and nearly like 80% of them stayed till the end of the webinar. So that's great. Thanks for joining us today. Thanks also to our panelists for their insights and making themselves available to us today, despite their busy schedules. Apologies if we didn't manage to get through all of the questions. We will collate those pending items and share them within the panelists for them to be addressed. So nearly 50 questions. So a bit of pressure on you guys. We initially started with Carlo that provided us a really informative session on the key features of ISO 45003, followed by Priya that highlighted why occupational health is gaining its momentum in Malaysia, and specifically in levels of business uptake. We ended up with Aditya telling us what the credibility of a global standard or universal standard can help us, encouraging more organizations to address this important issue. And we finalized with Sapna that gave us some insights of Canada's innovative approach in managing psychological health and safety in the workplace. We are also really grateful to all the professionals that are currently contributing to the ISO 45003 guidelines, including the committee manager and conveners for the work that they are doing. And if you want to stay abreast of the program and of the future guidelines, please get in touch with the Policy and Regulatory Engagement team at IOSH. You can also approach your national standards body if you want to know more about the standard and guidelines. I will now end this session by saying that you will be able to access the webinar at any time and download the presentation slides. Please also keep an eye on our social media. If you haven't subscribed yet to our YouTube, Twitter, and LinkedIn channels, and so please do so. And also make the most of this webinar to find out more about the publications and contributions of our speakers and the bodies they represent. I think that you've already gone through a general feedback polling, so you will be able to rate content and speaker delivery. So whether positive or negative, your feedback is really important to our growth. So please complete our survey. Please, everyone, stay safe, keep well, and I hope to see you all face to face soon. Thanks again. Thank you. Bye.
More relevant experience. A lot of the times that the final decision